Assalamu alaikum. Here we will discuss Whipple disease. Whipple disease is a rare multivisceral chronic disease and it was first described in 1907 as intestinal lipodystrophy. It is actually a disease which is caused by a gram-positive rod called Trophirema whippeli. The clinical symptoms occur because organism-laden macrophages accumulate within the small intestinal lamina propria and mesenteric lymph nodes and cause lymphatic obstruction. Thus, the malabsorptive diarrhea of the Whipple disease is due to impaired lymphatic transport. One of the important landmarks of this disease is that there are organism-laden macrophages in the lamina propria of the small intestine. This is the electron microscopy, and here we can see a macrophage. This is a macrophage, and inside the macrophage gram-positive rod is present. This is Trophirema whippeli. This is an important landmark on electron microscopy of this disease. Now, in addition to symptoms occurring in small intestine, there are some extraintestinal symptoms which occur in Whipple disease. Intestinal symptoms include steatorrhea, malabsorption, diarrhea. However, in case of extraintestinal symptoms, we have arthralgia, then we have erythema nodosum, then there are certain neurological symptoms, there are certain ocular symptoms including uveitis, nystagmus, ophthalmoplegia, then there is chronic cough, and there are certain cardiovascular symptoms. One important point should be kept in mind that chronic cough also occur in many other diseases including TB. TB has another similarity with that of Whipple disease. In Whipple disease, there is accumulation of the organism-laden macrophages in the lamina propria. Similarly, in case of TB, macrophages accumulate in lamina propria. Then how will we differentiate between two diseases histologically? Actually, in case of TB, the organisms are acid fast. We know that Mycobacterium tuberculosis is an acid fast bacteria, which is not in the case of Whipple disease. So in this case, histologically we can differentiate between two diseases. This is the histological appearance of Whipple disease, in which we can see that in the lamina propria, this is the small intestine, and then in the lamina propria of small intestine a large number of macrophages are present. These are foamy macrophages. Here again we can see the same. Foamy macrophages are present in the lamina propria of small intestine in large number. This is again the same. Here we can appreciate that inside these macrophages we can see gram-positive rods. These purple colored gram-positive rods. These are Trophirema whippeli bacteria. Now this is the periodic acid shift stain, in which in the lamina propria we can see these dark stained macrophages, and inside these macrophages there are bacteria. This is periodic acid shift stain. Again this is the same. These dark colored, purple colored are macrophages, dark pink colored are macrophages, and inside these macrophages we can see these are the bacteria. Gram-positive rods. Again this is the same. This is a macrophage, this is a foamy macrophage, and inside the macrophage these are gram-positive rods. This is the electron microscopy, which is showing macrophages. These are macrophages, and inside these macrophages we can appreciate the bacteria. These are the bacteria, these light colored. Now this is a quick review of the Whipple disease. It was first described as intestinal lipodystrophy in 1907. It is caused by a bacteria known as Trophirema whippeli, which was first cultured in 2000. This disease is more prevalent in males as compared to females, and male to female ratio is 8:1. The mean age of occurrence of this disease is 50 years. The clinical signs and symptoms include malabsorptive syndrome, diarrhea, weight loss, arthritis, arthralgia, and cardiac involvement. In addition, there are also neurological signs and symptoms. Diagnosis can be done by periodic acid shift stain. Then we have also PCR, and immunohistochemistry. This disease can be treated by antibiotics. Thank you.